Dr. Terri Show, have you ever struggled with just bloating after a meal or just feeling kind of yucky and, you're going for that acid blocker, because you want to tamper down that fire, or ever feel like you're pushing a thought through Jell-O, just kind of feeling like you've got brain fog, you can't really think or focus? Well, I am with my friend Jim LaValle again today, and we are going to talk about why could this be happening? And what does this bloated gut have to do with pushing a thought through Jell-O? Are they related? Well, they are. And join us for the conversation and you'll find out how. Okay, so I have a question for you.
All right.
What is the number one thing people complain to you about if they're a patient or even a clinician?
Oh, that's a good one. It's typically, I'm gassy, I'm bloated, I'm foggy-headed. Why do I have this rash? How come I've got this constipation or diarrhea? That's like almost everybody is, why do I feel so bloated? Before the meal, I'm fine. If it's a woman,
yeah,
I feel like I'm 6 months pregnant.
Yep.
After I eat.
Yeah.
Ooh,
I love this conversation already.
Exactly, right?
Why am I bloated and depressed?
That's just it. And so, gosh, I remember when I started writing about the gut. Gut health. So your intestinal lining is more than a processing plant.
Right.
Your intestinal lining has to do everything from absorb nutrients, take them in, help with metabolism, protect you from the outside world. So, you only have one cell layer thick of an intestinal lining. Epithelial cell. It's a little cell, got little hairs on the end of it. And when that breaks down, things get to your bloodstream. So
things leak into your bloodstream.
They leak in. You get gut permeability. And I remember when I first started talking about leaky gut in the early 90s, late 80s, I was talking about it. And there weren't that many papers on it. Mm-mm. But we knew it was a problem because when you took people off of high allergen foods, all of a sudden they weren't bloating as much, they weren't gassy as much. They it's that old story, someone comes into your office and you ask them a question, hey, how you doing? What's going on? And they look at you and they're trying to, okay. That's about it, right? I'm doing okay. Because their brain is chronically neurally inflamed, and it turns out there's this really important nervous system called the enteric nervous system. Connects the brain to the gut and the gut to the brain.
Yep.
And what you can think about is that the signaling that occurs from that is usually because of the immune system. So you hear about the gut immune brain axis. And then you hear about the gut brain skin axis because people develop eczema and different kind of psoriasis and skin conditions because their gut lining is broken down and now the immune system is activated. So for me, it's all about the gut and the brain for most people in the U.S. because if they were like me growing up, born 1960, I was sick all the time.
Yep, same.
Sick
Ear infections.
all the time. Mine was sinus and tonsils, and I would end up on the pink stuff.
Yep.
And I thought it was a part of my meal plan.
The bubblegum medicine.
Yeah, it was part of my meal plan.
Yeah,
it's like, when didn't I have it?
Yeah.
And then you got the purple stuff. You got the Dimetap.
Oh, yeah, I forgot about the cough
decongestant.
medicine. That's true.
You get the Dimetap, decongest. And so when you take a lot of medications that disrupt the microbiome, it turns out it creates something called dysbiosis, meaning that the good bugs in your gut have gone away, and now you're brewing a bunch of bad gut. And so it's like the Crips and the Bloods in a war.
Good one.
Right?
That's true.
It is. It's the good guys and the bad guys. It's the Crips and the Bloods. And the more you make bad bacteria, the more it influences the way you metabolize your hormones, the way you send inflammatory signals all through your body. So how many times have you had people, and I know, Terri, you're so dedicated to helping people with their diet and understand it. You've had people where you got them off of, say, for example, eating gluten and dairy, and they come back and say, wait a second, my hip doesn't hurt anymore.
Yes.
Right?
Yes.
You've turned off my inflammation.
My brain's working.
I don't need it. I don't need a hip surgery. I thought I was going to have a hip replacement.
No, it's true.
Yeah. And I'm feeling cognitively sharper. I'm not what I call pushing a thought through jello.
Yep.
Is what I ask people. Are you pushing a thought through jello? And it's amazing how many people actually identify with that.
That's a great analogy.
Well, yeah, if I ask them, do you feel like you're cognitively compromised, that your executive function is down? They look at you like, what are you talking about?
Yeah.
You know, or do you feel like your brain is unplugged from the wall?
Yeah.
That's exactly how I feel.
Exactly.
It takes 10 minutes for me to figure out how to find my keys because I absolutely can't remember where I put them.
Well, you said something too about when we were kids. You know, I grew up with two smokers. I was born in '67, so everybody smoked. My dad would have a cigarette in every room, you know, going. It was kind of, you know, they smoked on TV, right? Dick Van Dyke.
It was
show,
elegant.
You know, it was elegant.
Yeah.
But as a byproduct of that, I always had chronic ear infections, throat infections, strep throat, was on the pink stuff, you know, a lot. And I had severe gut issues, you know. I didn't know that's what it was. I was like you talking about leaky gut when it wasn't cool. But it's interesting because what I'm seeing so much and what we see so much clinically now is younger and younger kids having these issues with depression, ADD. I don't think we're Concerta deficient. I don't think we're deficient in brain stimulants. And nobody's really thinking about what's the root cause? What could this be from? What was the mom's diet like pregnant?
Exactly.
Right? So let's take this gut problem from all the potentials. Don't be depressed by the time we're done. We're going to give you some good ways to fix this stuff.
Absolutely.
But you have to understand it, right? Because, I've seen it so many times.
It's a core issue.
Moms breed diabetic babies. I mean, these things are happening in the gut, I think kind of in the womb. And then I'm even watching this, journey play out even with my new grandson who's been in the NICU. And, the thing now, they are pulling back on, doing so many things. But when I worked in the NICU as a nurse years ago, I mean, we put these kids on PPIs, proton pump inhibitors like Nexium and, Pepsid and things like
acid
that.
blocking
as
medications.
A baby, acid blocking medications as babies. And then they wonder why the kid is on multiple medications by the time they go to kindergarten.
Oh, yeah.
And then that's a whole nother conversation because,
Well, it's important because that's the journey, right? So the journey is there are whole hospital wings dedicated to what's called eosinophilic esophagitis.
Yes.
In children.
Preventable.
Right. In a lot of cases, if the mom, to your point, where was the mom's health? We know if you give a woman in her third trimester probiotics, eosinophil levels in that infant would drop as much as 40%. So the allergic response, eosinophils make histamine, guys. So makes you allergic. And then we know the progression. Oh, diaper rash, ear infections or croup.
Yep.
Sinusitis and allergies. So sinus problems, allergy problems, tonsil problems, asthma, autoimmunity.
Right.
That lineage all starts because of a bad gut.
Yep.
And 25% of the medications in the U.S. market disrupt the human microbiome.
Yep.
And once your human microbiome is disrupted, it leads to heart disease. It absolutely, when your gut gets broken down and so the bacteria start dying off too, right? You start releasing a compound called lipopolysaccharide. And it turns out the more lipopolysaccharide you have circulating around in your body, the more of the qualification for metabolic syndrome occurs.
Right.
So by default, all people with diabetes end up having gut permeability or leaky guts. The leaky gut being the popular term.
Which came first, the chicken or the egg?
That's just it. And sometimes it's one or the other.
Right.
Right? Because it's not always in a linear way. And I think we undervalue what stress does to your gut. It turns out when you're under chronic stress and you're releasing cortisol, and that's why people with chronic stress end up with irritable bowel.
Right.
Now, there's a big I know you have a lot of women in your practice. There's this intersection of irritable bowel and anxiety.
Absolutely.
And that's the gut-brain
axis.
connection.
Yep.
And so it's really important when you start to think about, how am I going to fix the gut? Because if high stress is causing a permeable gut, because you release more, people understand inflammatory cytokine now post-COVID, right? They heard it a million times. You release more inflammatory cytokines that trigger your nervous system to tell those cells of your intestine to do that.
Part ways.
They gap. And now all of a sudden, things are getting through that gap.
Right.
And it's presenting it to your immune system, just to give people the full experience. Oh, there's these cells called antigen presenting cells. I'm presenting something to my immune system, and now it's saying, uh-oh, this is foreign. We need to start reacting to that. That was a peanut.
Yep.
For me as a child, it was dairy. Interestingly, I literally, I mean, when I said, and I know in a previous episode, I talked about how I ended up with pharmacy, and I was always in front of the pharmacist. It's because I had a dairy allergy. I was a blue baby on a lot of antibiotics, double pneumonia at 4 months. But then I had a dairy allergy, and my father worked 7 days a week, 16 hours a day. He was a chef and was a pioneer in creating the whole certified executive chef movement, and really amazing guy, but worked a lot of hours. His way of showing me love:
feed you.
He brought me home a milkshake or a hot fudge sundae.
Nice.
Virtually every night.
Wow.
It was his way he could do it. And of course, I ate it or drank it, and also drank a gallon of milk, because that's what you're supposed to do in 1965 to build strong bones, and therefore stayed sick all the time. And to this day, as a 64-year-old male, I really have to watch my dairy intake. If I eat dairy, I don't get the kind of the bad mucus or any of that kind of stuff, but I notice the next morning, little achy and stiff, little puffy. The ring isn't sliding. It's, I'm making a gap.
Right on.
I've never been able to fully overcome that, because it was programmed from probably the time of infancy. But this is what got me into this whole area, was cleaning up that problem when I was 20 years old. Yeah,
and it was, very intuitive you to even go down that road at that time, because it wasn't a trendy topic. I love this conversation and sharing the journey. And it's so, it can be obvious to a lot of people if they have gut issues. There's so many symptoms that are obvious about leaky gut: constipation, diarrhea, gas, belching, bloating, all the obvious things, but some not so obvious things: rashes, acne. The skin's the first place to show toxicity, right?
Absolutely.
Eczema, things like that. Also hormone issues. Now I just was teaching, when I train clinicians at our trainings, I get into a gut conversation, and I always lead with, I know you came here to learn about hormones, and I'm talking about the gut. They're interconnected. You have to understand. And now we see a lot of studies that show the root cause of PCOS, polycystic ovary syndrome, is lipopolysaccharides from a leaky gut. A root cause of endometriosis, which is another, hormone problem, is a leaky gut. Women that have endometriosis have I don't remember how many times higher chance of developing irritable bowel syndrome, Crohn's disease. So we're linking the gut to all of these hormone issues. And one of the things I try to share with clinicians and even share with the audience is we can't have tunnel vision when we're talking about our bodies. It's all connected. You taught me this very well a long time ago. But I had a patient one time. This can even happen in the people that are just think they're doing all the healthy stuff. And she was an 18-year-old girl. Terribly sad story. She was born to a drug addicted mom. So by the time she was, 4 years old, she's pushing a chair up to the stove and making her own food. Just trauma, 2 years old, they find her walking down the road with a diaper. So anyway, she got out of that situation and was adopted, and at 14, and just an amazing kid, so smart. And she came to me because she was having all this, she's 18, she's having gas and bloating and all these problems. She's like, I don't know what's wrong with me. I eat really healthy. Tell me about your diet. I mean, I have vegetables, salmon, chicken, like all the things, the healthy things. So I was like, well, let's do a gut test. Let's do a leaky gut test. Let's kind of see what's going on, and let's do a food sensitivity test and see, what's happening.
Exactly.
Sure enough, she was having a histamine response to salmon, eggs, romaine lettuce, all the healthy things, because as a kid, the stress, the trauma, surely she fell on her head more than once and nobody paid attention. We talk about within 20 minutes of a head injury, you have intestinal permeability. And so we had to wean her off all of they weren't even inflammatory foods, but because those proteins were getting in her body, to your point, says, this is not supposed to be here. So she was developing I don't want to say allergic reaction, but it's more of a histamine response.
Yeah, it's sensitivity
reaction to these foods. And then so we had to unravel, fix her gut, get her help to deal with all the childhood trauma.
Of course.
Huge part of it. So she also had been on ADD medications. She had been on antidepressants. I mean, we see this in our teenagers, right? They're on every medication and really looking at the root cause. So that's kind of the kid part. And then we get into the, journey into as we get through our 30s, our 40s, 50s, and now we're having memory issues, cognitive issues. Continue this journey.
Autoimmunity. I mean, it's amazing what happens. So basically, when you think of it, our children are being turned on to that metaflammation journey
younger and younger,
much earlier, right? So between diet and look, when my son was playing sports in California, and he was a amazing athlete. I mean, 2-sport all-state athlete, state of California. That's pretty hard to do. Mm-hmm. But I would watch other parents, and the child is going to a private coach for 2 hours before the practice, which is 2 hours, and then they're doing something afterwards. Like after practice, they're staying on the field longer for one sport. And then sometimes they're doing 2 at a time. Mm-hmm. And so we have this thing of, I always make this joke, about, poor Jonathan, he's 6 years old and he hasn't published his first novel and he doesn't have a scholarship to Harvard yet. And I remember I walked my son into a daycare because we wanted to start getting him in socialization. We lived on this private lane in Cincinnati. No children, take him there a couple days a week. So I'm interviewing, walked into the first place, and I said, okay, so what do you do with the kids? And they open up this room, and it's a Japanese tea ceremony room.
Okay, that's kind of cool.
It's kind of cool. It is. But they said, your son is going to know how to do a Japanese tea ceremony.
Okay, that's too stressful.
And I said, where's the finger paint?
Yeah.
Does he do any finger painting? Do you have blocks? I'm really into blocks. When I was a kid, I built a lot of blocks.
Use your brain.
Use your brain. And what's interesting, there's data coming out now because children are using, we're on phones all the time, that they're not learning their intuitive side of their brain.
Right.
A lot less of their creative side of their brain. And so I think it starts there with a lot of stress. And then you enter into adulthood with stress pathways that are already fully activated. You've already changed the circuit breaker box, which is your brain. Yep. You got things turned off and things turned on that shouldn't be in that direction. And then you have this years of the gut being off, and now big changes start to happen.
Life starts to happen.
Yeah, I mean, there's even evidence that shows gliomas in the brain occur because of the gaps, the increased zonulin level and the big gaps that occur. But like you said, ADD and mood and diabetes, but most importantly, look at the rate of autoimmunity.
Right.
If you look at Fasano's work, who's, Harvard published researcher in the GI area, I mean, there's so much evidence that it's there, but you know what we end up doing? We end up pulling in at the local drugstore and getting a Nexium or getting a Prilosec and just saying, oh, that takes that down. Now, the problem with that is when I change the hydrochloric acid content of my gut, I'm changing all of the other intestinal pH that's responsible for how we're going to digest food, how we're going to absorb food, how the environment our good microbiome can live in, because it's pH dependent. And then you layer on top of it lots of drug therapy and, lots of sugar, lots of refined carbs. And it's not just that. So people go, oh, I'll eat ketogenic. You eat a high-fat diet, you create more of that lipopolysaccharide that you mentioned that relates to endometriosis and GI problems, in the PCOS women. And it's really understanding that you have to take care of your gut, but you can't just give things for the gut.
Right.
Because if somebody's stressed out, you have to help them to calm down. So going back to the first episode I did with you, they need to do their breathing.
Box breathing.
They got to do that. You got to calm it down, and you may have to give them things to calm them down because you got to calm it down and repair at the same time in order to get success.
Right. So, wow, there's so many different ways we could go here, but paying attention really to the gut and the connection that it could have to some of these common complaints we see in clinical practice: depression, mood swings, irritability, inability to sleep, inability to focus, and then, pushing that journey on down the line to the age that we're at right now. And, what's the number one building that's being built in America right now? They look like just beautiful resorts. Right?
Oh.
Memory care centers.
Yeah, I know.
And it's a real problem. So there is a piece of the gut because of metabolic syndrome, because of diabetes, that has to do with the brain.
That's right.
In that part of the journey.
That's right. So it turns out if we just look at your gut microbiomes breaking down, you make that little compound, lipopolysaccharide, it crosses the blood-brain barrier. So your blood-brain barrier is only one cell layer thick, and it gaps and gets compromised.
Leaky brain, right?
Leaky brain, leaky gut, leaky brain, leaky blood vessels, right? You get the endothelium also gets leaky. But when the lipopolysaccharide that gets released in your gut because of the microbiome dying off, and your liver can't handle the filtering anymore, and your lymph can't handle it anymore, now it crosses the blood-brain barrier and triggers microglial activation. Now, so when I talk about memory, I'm going to give you the exact way that dementia ends up happening. Because remember, people with diabetes, type 3 diabetes, dementia, Alzheimer's, people with diabetes have leakier guts. That's been shown. More LPS. LPS crosses your blood-brain barrier. It triggers the immune cells of your gut, called the microglial cells. Microglial cells say, uh-oh, we got to start the fight. It starts creating a lot of free radicals that are out there that is a response to the immune insult, and then you start to damage your neurons.
Right.
And then your neurons shrivel up, and they break apart, and the components of the neurons activate your microglial cells. So it becomes a vicious cycle. Now there's one more part to it, is that you have this compound called galectin-3. And galectin-3 is there to balance your immune system in your brain. Like, hey, we got too much going on over here, we better get going. When you are chronically activating those microglial cells, your immune cells are always getting turned on, and you've got that chronic inflammation in your brain, you start making too much galectin. And the galectin is what really accelerates the damage and the memory loss. And that is what is happening to a lot of folks in our culture. I talk to people and ask them. I have 35-year-olds talking about short-term memory loss.
Right. No, I see it all the time.
Right?
There's a hormonal component there, but a lot of it's the gut. And then there's another, big one that we've talked about in other conversations, not here on the podcast, that I think is important to understand is what are the cholesterol medications doing to the gut and then to the brain, right? Because we see now a direct correlation in studies between statins and type 2 diabetes and Alzheimer's disease.
That's right.
And so talk a little bit about that, because we always have patients ask, they're oh, my doctor said I got to get my cholesterol down,
Right, right.
And we talk in our world about, how many studies, one, that had a very, very slightly statistically significant decrease in Caucasian males only was studied in their heart attacks or heart disease.
Yeah.
But not been studied in other ethnicities, not been studied in females, yet everybody's on these medications. And now we're seeing a direct correlation between what's going on with lowering our cholesterol and our brain.
Yeah, but that's just a big one. And I want to go back and just retrace on one thing. Hormones impact everything.
Yes. Yep.
All of it.
Yep.
Right? In every direction.
Right.
So
hormones impact the gut impacts hormones impact the brain, all of
that. Yeah, right. It's at lean mass, you name it. How your
everything's
blood
about
sugar.
hormones.
Well, let's don't go that far.
Yeah.
But it's close. It's close.
In my world.
It's super important, right? It's super important. So, first of all, you ever hear of it? I know you've heard of it, but for you out there, NNT. Numbers needed to treat.
Right.
So in that study, what they showed was that it's a 99.
Right.
So what does that mean? 99 people have to take the drug in order for one person to get a benefit.
Right.
40% of heart attacks are with people with normal cholesterol, and they don't have blockage necessarily. So there's a nervous system component to that we aren't talking about.
That's right.
Almost half. Right. So instead, we're just giving people Xanax and Prozac.
Right.
But the reality is when you take a statin, there's two big things that happen. One is you're lowering cholesterol. So now I'm not making hormones, super vital for brain health. Two, I don't have the repair material for the cell membrane. So your cells are made up of what's called a double lipid raft. Lipids on the outside, lipids on the inside. So it's like an Oreo, right? Mm-hmm. Right?
Healthy stuff.
But it's healthy. It's the way your cell membrane is. You need cholesterol to keep those cell membranes intact. So when you lower your cholesterol really low, you're compromising your ability over time to keep those cell membranes
like deflating your
intact.
life raft, right?
That's a really good way to put it. It really is. That's like the sandwich is now a panini.
Yeah.
Right?
Yeah.
It's like everything's getting mushed down. And so the other piece is the drug-induced nutrient depletions that occur when you go on a statin. So we all have heard about CoQ10, and it's important because CoQ10 is important to make your mitochondria function, and your brain needs CoQ10, so you're not going to make energy as well. And it's also indicated in how your cells are going to generate energy everywhere. So now I've become inefficient at how I regulate my glucose, and now there's the increased incidence in diabetes. But
we have the GLP-1s.
Yeah, we can do that. we can layer it. And then, but it also depletes vitamin D, selenium, omega-3 fatty acids, carnitine, which is needed to burn fat. So, I never argue with cardiologists when they say, hey, look, standard of care, you have plaque, you need to be on a statin. Okay, it's standard of care. But when people just have elevated cholesterol, if in a previous talk, we talked about the fact that when your cholesterol goes up and you're making a bunch of what's called bad cholesterol, and so you should always ask for an advanced lipid profile.
So glad you said that.
Yeah, advanced lipid profile, right?
Because most patients will come in like, well, my doctor said my cholesterol's high. Okay, well, let me see it. Or what did they test? Well, it's just LDL, HDL, total cholesterol, LDL, HDL. Still kind of same. If you don't peel back the onion layers and look at the type of LDL is not bad. It's just what kind are you
needed.
making? It's needed. You need it. But we're not deficient in simvastatin.
That's
Right? That's not the right answer. So so much of this is preventable. And you said it previously with diet and the gut playing a huge role in increasing and insulin resistance, increasing those bad lipids, if you will,
right.
and just flipping that. With the diet. And the reason I kind of just brought in the statin thing is because so many people are on them. It's probably the number one question patients ask me about, and it's mostly guys that are on them, of course, because they have side effects that guys are not real happy about, with sexual function, with how their brain's working. They're like,
muscles
listen,
hurt.
my mother, my mother-in-law, she's I always use her as an example, but she could not, her memory was getting worse and worse and worse and worse and worse. She's 83 now. And I've got her, hormones tweaked. I'm like, God, I don't, she's like, I'm getting dementia. Well, finally, I said, are you on any new medications? Because every time we talk, and she goes, well, yeah, I didn't want to tell you because I know how you feel about him, but my doctor put me on the statin. And I was like, all right.
At 83.
Yeah, at 83.
And you're optimizing your hormones.
Yeah. And I said, so when did he put you on that? And she goes, about 2 years ago. Oh, that's when my memory started to go. So people aren't connecting this at all. They're like, oh, I'm just on this statin because I got to get my cholesterol down. Because she's 83. What is her...
What's the long-term goal on that one? Right?
What are we doing here?
Exactly.
But it's checking a box,
right.
And so it's really important people understand. Ask questions. I love what you say about asking questions. We said this on previous episodes. When you're getting prescribed a medication, whether it's a miracle drug medication like we talked about, or whether it's just, the everyday statin or the Prozac or okay, what are we doing with this? Is this forever? Because one of the things I try to tell patients, and we talk about this when we teach, is most of these drugs were only meant as a stopgap solution to dampen a symptom while you fixed the root cause.
That's correct.
And that is something that we have to make a paradigm shift in this country, not only with us as patients, but us as clinicians as, all right, I'm going to start you on this medication just to kind of dampen the fire, dampen the flames a little bit, but we're going to fix some other stuff so I can eventually get you off. I have not met a patient whose clinician said, we're going to start this temporarily, but we got to fix some other things in order to get you off of this medication eventually.
Yeah. And it's so interesting because I tell this story all the time because I, wrote with my team, databases on drug-induced nutrient depletion. You take a drug, it depletes a nutrient, and it creates a problem in the future. And the journey for people as it relates to, the issue is, okay, I'm Joe. I'm 30 pounds overweight, 40 pounds overweight, 60 pounds overweight, and I got heartburn. I got GERD. I'm going to start on a proton pump inhibitor. The proton pump inhibitor inhibits magnesium absorption, vitamin D absorption, calcium absorption, protein absorption, vitamin B12. I'm Joe. It's 2 years later, and now my blood sugars are starting to go up, and it's because I got low magnesium status. Yeah, I'm getting restless legs. I can't figure out why I got those restless legs. And yeah, you know what? My back's been spasming.
But we have some drugs for that.
Yeah, exactly. You got Requip. You got a Requip deficiency. You know what, Joe? Your blood sugar's going up. We better put you on metformin. Right. Metformin depletes CoQ10, depletes vitamin B12. You know what, Joe? Your lipids are up. Mm-hmm. We're going to have to get you on that statin. And now Joe is basically medically turned his metabolism off.
Right.
He's gaining weight. His numbers on his lab look great. Like, oh, wow, hey, these drugs, they work in those labs. Those numbers look good.
But I feel terrible.
But I don't feel good. Nobody comes in and says, you know what, thank you. I got that Crestor.
Yeah, I feel amazing.
I can't tell you the way I feel. Thank you so much. And I'm not, I get the value of it when it's applied. I'm not going to, completely diss it. At the same time, polypharmacy is one of the biggest causes of death because we don't teach Joe or Jane. When Jane gets menopausal, she's got a higher risk of dying from heart disease than Joe does.
Right.
So we don't teach them, you know what, with just what you said, we're stacking another drug on, instead of that PPI is meant for a 9-week course. It's not supposed to be on. And you get bone loss from it. And now you start seeing men with low T, for whatever reason, on a PPI, and they've got osteopenia in their hip.
Right.
And it's
a vicious circle.
It is. And like I said, pharmacist by training, I love modern drug therapy when applied correctly. Yeah. But we can't use it as an excuse. I always call it putting a Band-Aid on a bullet hole.
Ooh, good one.
Right?
Yep. Yeah, same. I came from, a hospitalist background, emergency medicine background. And it's how I got into the space because I just felt the majority of the patients that I saw in the emergency room and rounding on them in the hospital was because of a preventable chronic disease. And it really shifted my focus. And yes, we're great at stabilizing, heart attacks and strokes. And, we get them, they stay alive. But then I would just end up prescribing them on the same drugs that sent them home that got them there in the first place. So it's things to think about. We started this conversation with the gut and the brain. We can talk a lot more about the gut. We've said a lot. Let's kind of wrap it up. What would be, 3 takeaways from this whole conversation if we can just pull it back down
Absolutely.
For the listeners to take home?
Well, the first thing is if you're on drug therapies, chances are your microbiome's disrupted. And so you could be swimming upstream to trying to get well because of the drug therapy might be disrupting the way your gut is functioning. And so the big takeaway for me is from the diet side, make sure you're getting fiber. Fiber's really important for keeping
the good bacteria, right?
It feeds the good bacteria, keeps the bad bacteria down. You don't make the enzymes that cleave estrogen off and make free estrogen to recirculate and store. So fiber, important. And I honestly think nowadays taking a probiotic is really baseline important because so many people don't have a good, way of approaching that. If you're really having GI problems, and you have maybe autoimmune thyroid, you need to test for food allergies and sensitivities.
And sensitivities, right.
Find out which foods like maybe you thought were healthy or giving you a problem. Get rid of those things. That's incredibly important.
And fix your gut, and you can bring those things back in.
Yeah, 100%. Right. You'll restore it. And then it's, well, how do I repair my gut? And that's a little bit longer of a story. We could do part 2 on how do you exactly step by step on gut. I think you have to understand too that don't forget about if you have a stressful life, how are you going to manage, just like that girl that you told me about. I got to manage my stress in order to repair my gut.
Right.
And then I'm going to have to make responsible decisions about what I eat if I'm going to repair my gut. And one of the biggest ones, Terry, the overexerciser, formerly the overexerciser, Dr. Denois, is that when you overtrain, there's some amazing papers coming out now that shows that it disrupts the microbiome, changes mood, triggers more inflammation. I just presented that at the MBA Summit last 6 months ago. I gave that talk because all these players, when I talk to players, 25% of them have gut problems.
Yep, I believe that.
And it's because when you train a lot, you kill the microbiome, you make a lot of lipopolysaccharide, the microbiome changes in your gut, and now you're no different than the woman who's complaining of irritable bowel and anxiety.
Right.
It's just happening in an athlete because they did this. Both of them did the same thing. They disrupted the gut.
Right. That's good. And don't forget all the times they got hit in the head, because that plays a big role as too.
Of course.
Thank you so much. We have to do a part 2 about the gut, because we got off on some really good rabbit trails that all come together in the brain. But I think, if people wanted to know what is kind of the first thing that I could do today just to kind of work on my gut, well, probiotics are good. Increase your fiber, of course. We talked about that. And there's some other really great supplements like cat's claw and berberine and things like that we can talk about. But we'll break down next month about how to really heal a leaky gut. It is a journey. It's easier said than done, but it can be done. I've done it. But I really appreciate you and your expertise. Always, it's been a lot of fun. Thanks for joining us.
Love being here.
Thanks.